There are four muscles that comprise the group we commonly refer to as the rotator cuff. Now, the rotator cuff serve together to form a common action. These four muscles will contract to create tension here at the shoulder joint, which provides stability. By hiding the connective tissue, we can see the underlying head of the humerus, which will be better kept intact with the glenoid fossa of the scapula as these muscles contract as a unit. Now, individually, the four muscles are going to have independent functions, or they'll work with other groups of muscles to perform an action. However, collectively, know that the rotator cuff serve to provide shoulder stability by keeping the head of the humerus tight against the glenoid fossa. To help you remember the four muscles of the rotator cuff, I like the mnemonic SITS, S-I-T-S, which helps you remember the first letter of each of the muscle names. For orientation, begin by identifying the spine of the scapula on the posterior aspect of this bone. Then progress superiorly to identify the supraspinatus muscle. The supraspinatus muscle is going to act to help raise our shoulder in the motion known as shoulder abduction. Now, other large muscles are going to contribute to this dynamic movement. However, the first 15 degrees of motion are going to be provided by the supraspinatus muscle. So, the supraspinatus will begin to contract, the upper limb starts to move away from the body, and now it's at a point for muscular advantage of the other muscles to kick in and help to continue the motion of raising our shoulder. The infraspinatus muscle is going to be located inferior to the spine and, combined with the teres minor, assist in the action of lateral rotation of the upper limb, or in particular of our humerus. So here we can see the teres minor and the subscapularis both contracting along with the deltoid to produce lateral rotation of our upper limb. The last of the four rotator cuffs is located anteriorly, and the subscapularis is therefore going to produce a counter movement to the infraspinatus and teres minor. And this is going to be medial rotation of the upper limb. Now, medial rotation is a much stronger, more dynamic movement due to the presence of the other large muscles in the region which assist with this action, including teres major, latissimus dorsi, the deltoid, and pectoralis major. By fading these large muscles, we can see when subscapularis is activated to assist in medially rotating the upper limb. Now, commonly we hear about the rotator cuff when it comes to an injury, and the most commonly injured of these four muscles is the supraspinatus muscle. So, the shoulder is going to become aggravated and cause pain when we abduct the upper limb. As this muscle contracts, it is going to cause a pinching or a tightening sometimes within this region superior to the supraspinatus as it passes deep to the acromion process of the scapula. So, although the most commonly injured of these is the supraspinatus, this is going to lead to shoulder instability as a group because they can no longer as effectively keep the shoulder stable up against the scapula.